My name is Jimmy Jones, and I live in town in Prairie du Chien here with my beautiful wife Kelsey, who's a nurse at this hospital, and we just had our 6-month-old son.
Hi, my name is Stuart Cooley, and my wife and I live in Prairie du Chien, and she's a RN nurse in the OB department here at Crossing Rivers.
My name is Jason Spargrove. My wife, Miranda Spargrove, works in OB here at the hospital. Our oldest was born at the old hospital, and the other two were born here.
My name is John Kwame. My wife's name is Molly Kwame, and we have a 3-week-old daughter named Collins Marie Kwame.
So we had a 38-hour labor. You know, as a dad and a husband, you're supposed to be that protector of your family, and you're supposed to keep them safe. And I felt vulnerable at times because there's only so much I can do in the delivery room. And when I knew my wife was having such a hard time, it caused me to have a hard time just because I could only do so much. So I really had to rely on the professionals for that, and they took such great care of us, and especially great care of me. They were asking me, you know, am I okay, and am I comfortable, and is there anything I need? So I really felt like a patient too. There was just so much consistency in all the nurses that we had experiences with. They all took great care of us and showed us a lot of love and care, and really had a lot of passion for their jobs.
It was absolutely wonderful. I knew some of her coworkers. After our experience, I find myself wanting to keep in touch. I always ask Deanna, well, how is so-and-so? Or just because these people left a big impression on me of how wonderful the care was. It was like we were welcoming him to our family, but we were part of a bigger family, and that was really impressive. It was just like you're in your living room, you know, it's just like you're surrounded by family and friends. We were included in everything, and it was just a wonderful experience.
Oh, it's very positive. As a dad, it's very worry-free. You know, once you get here, you know, I know we're in good hands, and I don't have to even just had to get her here, and that was a stressful part of my job, and now I can just sit back and enjoy it. So,
My wife was showing symptoms of preeclampsia, which is something I didn't really know about before, and luckily the nurses and the providers here kind of explained what that was and really how serious that was. She was showing preeclampsia with severe symptoms. The staff and the providers and the nurses, they always answered my questions, and they made me feel included in decisions, and you know, I wasn't included in decisions, but it was made me feel like I was part of it, kept me up to speed. I would never felt like I was on an island or I was in the dark or I didn't understand what we were doing. When we were getting our discharge instructions with Laura, I asked her, you know, how much is rent here? We like it here, we like to stay around.
My wife, she's only ever wanted to do 2 things in her life, and that's be a nurse and a mom. She's wanted to be those 2 things since she was a little girl. The biggest surprise for me was just the level of skill sets that they require. They need to be so proficient in so many different things that I wasn't even aware of. And so that really opened my eyes to what my wife does, and I'm just so proud of my wife.
It was just amazing to see that, you know, that's what she did. I was so impressed and so amazed. The quality of the work, I was just really blown away by what she does. To see it firsthand, I was really like, you do this? You know, it was really impressive and really left a big mark on me.
seeing it firsthand as a father, being up here when my kids were born, from knowing that she does this every day she's at work, you know, it's kind of gives you a perspective of, you know, how long her, you know, she works 12-hour shifts, so, you know, there's been days where she said she's had 4 or 5 different babies and moms, so you're moving stuff around, and I just, you know, she gets a lot of perks for me for being able to do that. From a coworker perspective, after Layla was born, we struggled for 3 years to have our second one, and I asked her at one time, do you want to leave? I think it'd be good for you to leave OB because being around babies and everything would be hard. But she said no. She wanted to stay and help and deal with that. So, and that was part of her coworkers and helping her deal with all that. I give her a lot of props for what she does, and she's an amazing woman. I just love her to death, and I'm glad she does what she does.
I guess I've always been really proud of the fact that Molly's a nurse, but I don't really think I had an appreciation for exactly, you know, what it was day to day that she has to do. Being here, going through the experience, just seeing what exactly it takes to be not only a nurse but be a great nurse and do that high level of care, I think it gave me a brand new appreciation for it. This situation just confirmed even more, you know, that I couldn't do what she does. So it it's a very demanding job, and I'm proud of her for doing it.